You are listening to Fox Radio 910 or 104.3. Welcome to Let's Talk About, our bi-weekly program designed for our senior listeners. We feature a variety of guests and topics which we think may hold special interest for our senior audience. And this outreach to the Roanoke senior community is sponsored by Crowning Touch Senior Moving Services at 6704 Williamson Road in Roanoke. And my name is Linda Ballantyne, founder and CEO of Crowning Touch. We are the only moving company that focuses on seniors making a move, and the only moving company that can write you a check. So how do we do that? Well, we sell what our clients no longer want in either our consignment shop or our auction house. And then we split the proceeds 50-50, and that money helps offset the cost of a move. In fact, our Browse and Bid auction is going on this next weekend and features over 1,800 lots. You can bid online or in-house, and there is no auctioneer in our hybridized auction system, which makes it extremely convenient to browse and place a bid when you feel like it. To register and see pictures of everything being auctioned off, you may go to crowningtouchusa.com. And of course, if you need a moving estimate, give Anna a call at 540-982-5800. So now today our topic is plastic surgery, and I want to introduce our guest, Dr. Norman Harris, a board-certified plastic surgeon with an office right here in Roanoke, easy to get to, 5115 Bernard Drive, right off of 419 on the third floor across from the county office building. And I invited Dr. Harris to join us to discuss the ins and outs of plastic surgery and all its many facets. He's a great friend. I'm so glad he could be here with us. Terrific surgeon. So thank you, Norm, for being our guest today.
Lynn, it's so nice to be here.
I'd like you to share a little bit about yourself, Norm, like where you're from, what path you took that led you to your medical practice here in Roanoke.
Sure. I was raised in Kansas, and that's where I went to medical school and general surgery residency and plastic surgery residency at the University of Kansas Medical Center. Then after that, I went to a fellowship in Boston for a year. And by that time, my whole family had moved to Florida, so I went to Florida instead of back to Kansas. And from there, I moved to Roanoke, and I've been here since 2000.
Well, you left out that part where you went to Harvard.
Well, yeah, in Boston.
That's
where I went in Boston for the fellowship.
Okay, I got you.
Yeah.
That was pretty special.
Yeah.
Pretty special selection.
It was a wonderful experience for me.
All righty. Let's talk about what is plastic surgery. Let's define that because it's very special. It has a wonderful history. Maybe you can enlighten us a little bit on the history, not only in the U.S., but in Roanoke.
Plastic surgery comes from the Greek word plastikos, which means to form. So it doesn't have anything to do with the substance plastic very often, but it originated dealing with form. And there's basically two broad branches of plastic surgery: cosmetic surgery or aesthetic, which changes somebody's appearance.
Right.
And there's reconstructive surgery, which is to change something that is abnormal by trauma or tumor or something like that. But plastic surgery originated in after World War II because for the first time in history, we had soldiers returning who had survived horrible injuries. And a whole new practice developed on how to reconstruct those. And that started off with general surgeons who then specialized in these horrific wounds and burns and things like that. And they eventually splintered off and became plastic surgeons. So
who was Dr. Murray?
So Joe Murray was a plastic surgeon in the Boston area in the late 50s who did the first kidney transplant that from a living donor to another living donor, and they picked identical twins. Then he did the first cadaver transplant where it was from a deceased person to a living, right. and he did the first living donor kidney transplant, and that was remarkable. The world had never seen anything like that, but because of his training and because he's used to dealing with small blood vessels and doing delicate microanastomosis underneath magnification, he was able to do those transplants. And recall that when that happened, that changed not only just medicine and surgery, but we had to make some advances in ethics and we had to make some advances in medicine because we didn't have any real immunosuppressant drugs, which is now, we know, a key part of transplantation surgery.
Right.
And who's a good donor? Before that point, they did not even have a definition of brain death. So that the definition of brain death, which is based on blood flow to the brain, that had to be developed and refined and agreed upon before they could decide who could be a deceased donor.
So a plastic surgeon actually developed the whole art of kidney transplanting or transplanting,
in general. That's right. And he won the Nobel Prize for that.
Wow.
Yeah.
So that's a pretty interesting kickoff for plastic surgery. And here in Roanoke, I happen to be friends with a man who is no longer alive, but it was Dr. Brobst. And he was the first plastic surgeon in Southwest Virginia. And I remember his tales where he said he would stand up on his feet for 36 hours at a time, putting somebody's hand together that had made a left turn signal and threw his hand out the window. And, it was a real story of how he pioneered it.
Henry Brobst was a wonderful man. He was very kind to me when I came to town in 2000. And he'd been here shortly after World War II.
Right.
And so he was really one of the earlier plastic surgeons. And Roanoke was lucky to have him. And he did legendary work and was known for his sense of humor and the jokes that he was fond of telling.
He was a great guy.
Yeah.
So you can be a plastic surgeon and still have a sense of humor.
Yeah, that's nice.
It seems like it's such a serious endeavor that it's a neat thing. But my question for you then is, if somebody's even thinking about plastic surgery, and I went to your website, we'll invite people to it later, but you have a whole list of things that you do. But
that's correct.
How do you pick a plastic surgeon? If someone's out there thinking about plastic surgery, how do they go even find somebody?
That's a great question, and it's tricky because sometimes people will advertise as a plastic surgeon that are not board certified by the American Board of Plastic Surgery.
So they're just a family practitioner, or what is the deal?
They could be a variety of things,
okay,
and they it just could be a bit misleading. So buyer beware.
Right.
It's very important to understand that your surgeon's been properly trained and educated for this, and it's easy to do. You can go to the American Board of Plastic Surgery, and they'll have the list. They'll have a list.
Plug in
on my website. I have links to easily go to that. The other thing is if they are a member of the American Board of Plastic Surgery, then by definition they're board certified because that's one of the requirements to be in the society.
Right, I got you. You had an interesting conversation with me before we went on the air about how the career of a plastic surgeon changes over the years, and so has yours.
Yes, it has.
So why don't you enumerate that a little bit for us?
We have to wear several hats in plastic surgery. Now my hat, so to speak, is primarily cosmetic surgery. But in the beginning, when you're young and in your training, there's a lot of reconstructive surgery. And that is that's in part by design because you're training at a large institution which has the facilities and the patient flow to take care of that. For example, the University of Kansas, we have an outstanding burn unit, which is the major burn unit in the Midwest part of the country. Mm-hmm. And all burns, horrible burns, big burns from all over would fly in and took a lot of manpower. And it's an intensive care unit that is manned 24/7 by people trained just specifically for that problem.
Is that when you have to have a big team? You go on in there and you have operations that go on for hours and one man can't do it and you need...
Right. Yeah. So
okay.
you have multiple people, not just one person in private practice
right. in
Roanoke, Virginia. So some of those cases are just not practical to be done in a for sure a small private practice, but also in a smaller town. For example, there's not a burn unit in Roanoke.
Right.
They have to go someplace else.
Where do they go?
I think they go to Duke or
okay.
I don't think even the University of Virginia has a burn unit anymore if I'm correct.
Really specialized.
Yeah. So you start off heavy with reconstructive and trauma, reconstruction from cancer, reconstruction from injuries. And then in hand surgery. So a lot of the hand surgeons in the United States are actually plastic surgeons.
Uh-huh.
To get to become a board certified hand surgeon, you need to have completed a plastic surgery residency or a orthopedic surgery residency, and then do a fellowship, which combines both those specialties, and then pass some testing on that as well. So it's early in my career, it was a lot of hand surgery.
Gotcha.
But now it's sort of evolved over time, from trauma to cosmetic surgery over the last 20 years. Still do some hand surgery, but also some skin cancer stuff, but it's primarily cosmetic at this point.
I was looking at some data. Plastic surgery percentages are way up globally. And even since 2019, here's some interesting data. Liposuctions are up 23%. Breast augmentations are up 4%. Abdominoplasty,
yeah.
tummy tucks are up 37%. Mastopexy breast lifts are up 30%. And eyelid surgery is up 13%. And in order to deal with that, globalization has made it a lot easier to get surgery. America is not even in the top 10 of the countries visited for surgery procedures. And here are some of them. South Korea is first, then Brazil, then Mexico, Greece, Italy, Germany, Turkey, and even Poland. The procedures are generally cheaper depending on the complexity, but there are big risks. Why don't you address that? Let's talk about some of the drawbacks of seeking surgery procedures outside the U.S. and what people can. There's a risk. They're getting them cheaper, perhaps, but it may in the end cost them a lot more.
Sure, and there are fantastic surgeons, of course, worldwide, and the main thing is to discern that your surgeon is board certified
again,
right? But even then, there are some downsides to going abroad. Your follow-up visits are difficult. So how do you get your stitches out? How do you, if you have a problem or a concern or a complication, getting to see your physician again can be difficult. Also, you have to include the price of the traveling and the price of your
well, they got to
housing.
stay down there too. I mean, they have
Right.
to stay there probably for several weeks. You
Right.
get stitches out, you need to be planning to stay for a couple weeks.
Right. I think generally if you really do your research and compare apples to apples, I don't really feel like it's going to be that much more expensive in the United States.
Uh-huh. Gotcha.
And I've certainly seen some patients who have gone abroad and then had a complication, and now they're back home in Roanoke, and they're spastic in terms of what should they do about it.
Right.
And we'll do the best that we can for them, but we don't really know exactly what the
patch-up.
operation was, and
Right.
we're coming in during the second scene.
What are the procedures that you perform the most, and are there any that you don't do?
I do a lot of facelifts, eyelids, breast lifts, breast implants, tummy tucks, ear work.
We were talking about poor former President Trump's ear
Yeah.
earlier, and that he may never get it fixed.
No.
You were saying that he could have it put back together so it would be almost unnoticeable, but
That's
he will
right.
probably wear it as a badge of
Yeah,
honor.
we'll wait and see what he does, but President Trump does. But I think he's not had it fixed yet. So
How about women versus men? In other words, I'm just assuming more women, because of the cosmetic interest, get plastic surgeries done more. I mean, is that an assumption? Is that a fair assumption or not?
no, that's fair. There's more females than males getting aesthetic or cosmetic plastic surgery. The males usually center along getting their eyelids done
Mm-hmm.
and getting some Botox in their forehead, just for professional reasons, because they want to look more refreshed and not look angry.
Right. Yeah, right.
People, what they call the 11s on their forehead, sometimes that can be misinterpreted as you're scowling or you're frowning because you have that line. And people will say, well, why are you mad? It's like, oh, I'm not mad.
Right.
And so they,
That's
so
interesting.
they get that to address that. I see that with men quite a bit.
That's interesting.
Yeah.
Well, you mentioned Botox. Let's talk about Botox. I always thought of it as a temporary fix. Here's what I know about it. You have to come back 6 months later. I don't know. Maybe it's a year later. I don't know. But it's not permanent like a facelift, but it has some of the same effects. Why don't you fill us in on Botox? Is it dangerous or not? What is the deal?
Botox is a toxin that is the botulism toxin, and it works by paralyzing muscles. That's why when people contact botulism from a spoiled can of soup, their diaphragm gets paralyzed. Wow. And they stop breathing. Wow. That's why it's dangerous. In controlled medically produced botulism toxin, it's not dangerous if it's applied by somebody who understands how to do that. It's a smaller dose, and it's used to, again, paralyze muscles, but of course not your diaphragm. It's paralyzing muscles of your face, particularly on your forehead.
What does that feel like? I mean,
it's an injection. It's a small needle, and it's a series of injections. So it's good for the lines next to your eyes, or the crow's feet, or the lines you have across your forehead, or the lines that you have on top of your nose, and it lasts 3 to 4 months.
Okay.
But it's been my experience when my patients who get it regularly every 4 months, sometimes will go longer and longer. If they've been doing it for a couple of years, sometimes it seems to me that it takes them longer to reanimate their muscles.
I got
you. And while the manufacturer won't say that, that's been my experience. And to me, that seems like if I put your arm in a cast for a month or 2 months and take it out, your muscles will have atrophied.
Sure.
But if I put your arm in a cast and don't take it out, don't let those muscles work for 3 or 4 years, when I take that cast off, your muscles are going to be, I think, irrevocably atrophied. And so it's just my impression that there may be something of that going on with people who have long-term Botox.
That they might even lose the ability to make an expressive face. Is that, in other words, it's so relaxed, you just...
It'll be, I think it'll be, the lines on their forehead will be much smaller, and they will go longer and longer between doses of Botox.
Let's talk about tattoos, since they're such a big deal.
Yeah, okay.
And you had all of that experience in burn units, and I understand that lasers are what's used for that particular type of, is that considered plastic surgery when you're using lasers, or can people who are not plastic surgeons use lasers, and then that could be dangerous, right?
Well, there's all kinds of people that use lasers, and certainly plastic surgeons use lasers, and there's others who do a fine job with lasers too. Lasers are just another way of burning skin in a precise fashion. And with a tattoo, the goal of the laser is to burn the pigment, to evaporate the pigment without destroying the skin. Now, I see a lot of advertisements that show fantastic results, and I'm sure there are some fantastic results, which depend a bit on the laser, a bit on how deep the tattoo is, and maybe the pigment that was actually used for the tattoo. But in my practice, I see a lot of people who have failed lasers, and they still need to get the ink off for whatever reason, and which could include working for the armed forces or a police department, law enforcement department, because some of them have some rules in terms of where you can have a tattoo and where you can't.
Oh, yeah, right.
So to get the ink off for these people, I surgically excise the ink, and sure, it leaves a scar, but the ink is gone, so they can proceed with their life as they need.
I got you. All plastic surgery is obviously not cosmetic. Some of that is, like you said, it's very strategic. Is that the word? In other words, well, it may or may not be the word, but you go on in because you're after other results besides cosmetic results. For instance, I was reading that sometimes plastic surgery can heal migraines, but I think you pointed out that might just be those are the people that are using Botox to get rid of migraines. Are there other conditions that are alleviated by plastic surgery that you can think of?
So Botox and migraines is something that some plastic surgeons will specialize in. I don't personally do that, but I know there are some neurologists in the area that do that. And I feel like since that's something that could probably be run through health insurance, that's a good avenue to go. But by relaxing the muscles on your scalp area, that can give certain people with migraines some relief.
Let's talk about the cost just a little bit, because there's a real distinction between what Medicare or other insurance companies may cover. Why don't you talk about that for just a minute?
So generally, reconstructive surgery or something to deal with skin cancer or arthritis or
How about eyelids that are drooping and in your way? Can those get covered?
Yeah, sometimes a drooping eyelid, if it's impairing your vision, can be covered by insurance, but there's very specific qualifications for that, where an eye doctor should measure your visual fields and things like that, and plenty of ophthalmologists will be able to help you with that problem as well. But there's another approach to upper and lower eyelid surgery by plastic surgeons, which is from the angle of primarily improving your appearance or your aesthetics, and that would not be covered by your health insurance. But actually, the prices may surprise you by the time you talk about copay and things like this on your insurance plan. And if your plastic surgeon can do this procedure in his office, and you can avoid paying a facility fee or an anesthesia fee, it may not be that far apart.
I got you. Let's talk about, you've been doing this a long time.
Yeah.
And I'm sure you've got some special stories, people that you remember, people whose lives you really changed in a pretty powerful way that needed plastic surgery. Why don't you share one or two of those stories?
I've had patients that have become friends, lifelong friends after their case, and I'm still in contact with them. When I was in Boston, I had a patient, John Zani, who was the mechanic for the school, and he changed the oil in the school buses. In a complicated story, he gets involved in a fire in that garage and has big burns. The entire garage was on fire, and he ended up in the burn unit in Boston. And I operated on his hands 2 or 3 times that year, and he still had a lot left, many operations left, not only for his hands but for his face. And when I moved, he says, "Well, what am I going to do now?" He says, I said, "Well, you'll find somebody up here." He says, "Well, I would like for you to be my doctor.
Yeah.
So I'm going to move to Tampa with you."
Oh.
And so he moved the same time I did.
Oh my gosh.
And I ended up operating on him for, off and on for the next 10 years until we got him where he needed to be. And he ended up making his living as a locksmith with the hands that his burn unit doctors initially felt would likely need to be amputated.
Wow. So that's got to be really sad.
Yeah. So stuff like that is.
We need another story like that. What about that fellow who had that growth on his head?
I had a patient walk into my office years ago who had a large lipoma on his forehead, literally the size of a grapefruit. And he had coiffed his hairdo to try to hide that from everybody. And he was basically a hermit. I think he was a telemarketer, as I recall, and never left his house because he was so mortified by this tumor.
Wow.
Somehow he ends up meeting a girl and getting married. And after a few years, his wife told him, "You've been telling me that you think this is a brain tumor that's going to kill you, but you don't seem to be any worse for the wear. And I'd like to go snorkeling with you. So let's go and take care of that tumor on your forehead."
So the mask would fit?
So he had a snorkeling mask on.
Wow.
And he comes into my office, and he doesn't even want any of my medical students to come in the room. He's so ashamed of this.
Wow.
And when I looked at him, I said, "This is not what you think it is, and this is going to be something straightforward to fix." So I took him to the operating room, made an incision transversely across his forehead so it would blend in with his forehead wrinkles, took this giant cyst, this giant lipoma out, took off the extra skin, sewed him up, and I talked to his wife after the operation. She says, "Is there anything special I should do?" And I said, "Yeah, get him a haircut." And so now he didn't have that. When he came in, he had his hair all combed up and a completely new affect. He was turned around.
Wow.
And so it's amazing to me that something so straightforward and simple as that can be so influential on a person's happiness.
No kidding.
Yeah.
Well, we have time for more stories if you have one, but I also want to ask you, if somebody were to call you, somebody who's listening right now, and they want to get the lay of the land or explore a concept with you, I know that if they were to say that they heard this program, you're willing to give them a free consultation.
Absolutely.
And tell me about your office. I mean, who's in there to help you? They're going to call, they're going to come in, they make an appointment. How does that work, Norm?
Yeah, just call and and make an appointment. I see patients on Mondays and Tuesdays. I operate the rest of the week. But if you leave a message on our answer machine or you get us during office hours, we'll be happy to get you in as soon as possible. And if you mention this program, I'll be happy to give you a free consultation, talk about whatever you'd like.
What about let's talk about the type of restrictions that can get done in your office. We've got people that might say, well, I don't want to have to go into the hospital and pay that kind of bill. I'd just as soon have it done in the office. So how does that work? I mean, or should they be worried or concerned about doing it in your office and not having other ready help available? Do you anesthetize there? Do you have anybody that comes to help you? How does that work?
Well, sure. There are other people there to help me, but in my office, I do not do any general anesthesia.
Okay.
So if they need to go to sleep, if they're going to have a problem, or not a problem, if they're going to need to have their airway monitored, we do that at Lewis Gale Hospital with a board-certified anesthesiologist and a full crew. So absolutely no risks.
But you'll do local anesthesia.
Yeah, local anesthesia is not a problem, and I can do lots of things under local. My facelifts are all under local.
Really?
With oral sedation, so you have a little bit of Valium and local anesthesia.
You have to keep injecting them if you're going along and doing this facelift thing?
I use an anesthesia mixture that lasts 6 to 8 hours. So, so it's just one round of that.
So the whole face, you don't feel it?
No.
Wow.
So eyelids, facelifts, ear pinnings or otoplasty, neck lifts, most of my tattoo removals, and anything that I can get away with doing under local, we'll just do it like that. It's simpler for everybody.
Now, how do people... I had a friend that had a facelift. It was a long time ago, and she went to Florida to have it because she wanted to recuperate, and she didn't want anybody to see the scarring from a facelift.
Right.
I mean, what is the healing process like? She was gone for 2 weeks, came back, and, I don't know whether she stayed in for a few more days or what, but is that generally... There's a lot of black and blue that goes on with the facelift.
Yes, there is. And so that usually lasts 4 weeks.
Yeah, I was going to say, especially if you're older, right?
Right.
I mean, it takes a lot longer.
Yeah, and that's why it's important that I make certain everybody gets off fish oil and aspirin for 2 weeks beforehand. But they can usually power through it with a scarf or a turtleneck or some clever sunglasses. And that works both ways. I mean, I have people from the East Coast come to Roanoke to hide out for 3 weeks. So they're not all leaving Roanoke and going to Florida. They're coming from other places to the Roanoke area too, because our prices are better, and they usually have a friend or a relative here that they can recuperate with.
Yeah. What is the? Can you detail out for me one of the most challenging operations that you did? We've got another we just have about a minute and a half, 2 minutes, 1 minute.
There's a bunch of different challenging operations. Free tissue transfer is one of the most challenging operations for plastic surgeons, where you take tissue from one part of your body and you put it to another part of your body. It's used frequently with breast reconstruction after breast cancer, after mastectomy, or trauma, especially lower extremity trauma where there's exposed bone and simple skin graft won't work. And that's a very delicate and beautiful procedure, which is done under the microscope. That generally requires a team, more than one plastic surgeon working on that.
But you've been a part of those.
Yeah, sure. Did a lot of those primarily in my training.
Yeah, I gotcha.
Yeah.
That sounds fascinating. Well, I'm going to go ahead and make sure that people know how to get a hold of you.
Thank you.
Because you are not only a great surgeon, but a great guy and a lot of fun.
Thank you.
So I personally recommend Dr. Harris. And you may reach him at 540-776-6979, or you can visit his website at dr-harris.com. That's doctor spelled out, DOCTOR, Harris.com. Again, mention this program, get a free consultation. I want to remind everyone to please join us again at noon on August 9th for another edition of Let's Talk About, sponsored by Crowning Touch Senior Moving Services. And don't forget to check out our consignment shop as well as our auction house. You can do that online at crowningtouchusa.com. And remember, we resell more household goods than any other outlet in the Roanoke Valley. So come find your special deal. Thanks again on behalf of Roanoke Seniors to Fox Radio 910. God bless you.